And now we're going to begin a mock trial review of the hip, and it's going to be PROM accessory, special tests, and palpation for tenderness. Okay, so let's have you lay down. So we're going to start with an inferior glide for flexion. Quantity, quality. I'm choking my hands out laterally and I'm gliding in. So that's for adduction. Now I'm going medially. Any pain?
No.
Okay. Quantity, quality. And the inferior medial glide is for abduction. So now I'm going to do the posterior stretch. So I'm going to go ahead and grab a towel and we're going to slip that underneath your butt right here, just on one side. Bring you up, and this is for internal rotation. Okay. And for the anterior stretch, I'm going to have you roll over on your belly. And that's for extension and external rotation. Okay, now we're going to move into special tests. So the first one we're going to do is Faber. So you can roll back over on your belly. And I'm going to put you in a figure 4. Lay back.
Oh.
Any pain?
Just a tiny bit, but I think it's my muscle stretching.
Okay. Now I'm going to do ASIS compression. Any pain?
No.
Okay. Okay, next one, Thomas test. We did that one in the last video. Over test, I think we did in the last video. We're going to do a scour, which is for a labral tear in OA. So I'm going to bring your leg all the way up. Any pain?
No.
No labral tear. I would have you do a fader. So I'd bring you into flexion, internal rotation, and adduction. And doing that again, I would actually bring her up into external rotation first and abduction, bring her into adduction and internal rotation. Okay, now the Stinchfield maneuver for osteoarthritis. So I'm going to have you bring your leg here, hold it here, hold it up. Any pain here? Okay, you can relax. Now I'm going to do the piriformis test, or also known as the Fair test. So I'm going to bring you straight up into flexion, and we are going to take you straight into adduction. So do you feel that in your back, in your butt? Okay. So that would be the only other test I'd want to do is the maximal squat test. So I'm going to have you stand up right there. We're going to do a squat. You're going to bring your arms out like this, and we're going to hit a full squat. 1, 2, 3. Any pain?
No.
Okay. Now we're going to do palpation for tenderness. So I'll have you lay on your belly. You can have a pillow for comfort under your belly. Okay, so here's your greater trochanter, which I can confirm in external and internal rotation. I'm going to check for trochanteric bursa. I'm checking your ischial tuberosity for your hamstring tendon, which I can bring your leg up like this. Ask you to hold here. Don't let me move you. Right there, I feel your hamstring tendon connecting. You can relax. Here's your ischiogluteal bursa. Then I could go from sacrum to ischium and palpate the sacrotuberous and sacrospinous ligaments right here, holding your sacroiliac joint together. Then I would check your, anything else back here? No, okay. And piriformis muscle, so I would check PSIS, trochanter, ish tube, right between there. Any pain there?
No.
Okay, have you roll over on your back. I would do the lateral femoral triangle. Put this leg down. Okay. Hold there. Hold there. Don't let me move you. Okay, you can relax. So there was the ASIS, I felt it right here. TFL is going to be right about there. And I'm not sure for TFL if I do any confirmation, because Baldwin just found it in the video right there. But the muscle would be leg fully extended, leg internally rotated. If I wanted the action, I would say hold your leg right here. There it is right there. Okay. And the rec fem, you can relax, is right here. So I could ask you to contract your quadricep muscle. Contract this muscle right there. So that's your lateral femoral triangle. Here I could find your iliopectineal bursa, ilioinguinal ligament, and find your femoral artery. When I had you on your back, I should have checked glute max. Wow, something's really going on out there. So the last ones that I'm going to do are gluteus medius and the SI joint line. When I had you over on your back, I would check the SI joint line, but I'd also do the gluteus medius. So let's have you roll over on your belly one last time. Sorry, I forgot. These are the last two, I promise. And you lift this leg up. There's the glute max, relax, and press your, I'm at the iliac crest, just superior and laterally. Let's bring your leg out into my hand. There's the glute med right there. Okay, that's all. Thank you.